I was able to start pivoting and cross-selling these hospital indemnity plans to bundle with the Medicare Advantage plan. And I'll be honest with you, Rob, there's a couple of Advantage plans I didn't even sell, but I still sold this plan. Your clients will sell the product before you ever have to do it. And I've sold Medicare Advantage plans off of sisters or brother-in-laws or aunts or uncles saying, well, this other plan works so good. You need to go get this plan from him. They come in to get the Heartland plan, but they're not even my client. So I end up getting the Advantage later on down the road too.
I wish when I started my insurance journey 8 or 9 years ago that someone would have told me about this simple little plan that you can attach to every Medicare Advantage client that you sit down with. And not only is it going to protect them better, but it's also going to bring more revenue into your agency. That plan is called a hospital indemnity plan, or HIP for short. And I have one of my good friends on the podcast today who we're going to discuss what a hospital indemnity plan is. We're going to talk about why clients need this plan. And we're also going to give you some step-by-step instructions on how to properly set one up. Zeb Zinn, welcome to the podcast, my friend.
I appreciate it. Happy to be here, man. It's been a long time since we've got to sit down and talk. So this is going to be fun, but there's nothing better to talk about than how to, bundle coverage and help people better. So it's going to be great.
Absolutely. Well, Zeb, I want to just take a few minutes here. Can you give people a little bit of the journey, how you started in the Medicare industry? Because I think it's important. And then as you talk about the journey from LOA agent and maybe define that a little bit into independent agency owner and kind of even your cross-selling journey and how you begin to start selling hospital indemnity plans.
Yeah. I mean, I can do that. So I started out, like, as you know, so for the people at home, I started out as an LOA agent, which is a licensed only agent. I was working for a group of agents at the time, which we can get a little bit into that, but a great group of people that were able to help me build my business and help me transition from an LOA agent to an independent broker, which we are today, and build an agency all at the same time. But license only agent means, mostly I didn't own all of my business, but then they gave me the opportunity after a program of 3 years to transfer over and own my business at the end of that. But in the beginning, there's the plan that we're going to talk about today. I always tell people, like, I've talked to Rob, I've talked to a lot of the agents that we have today with us. The plan we're going to talk about today is something that put food on my table whenever during AEP, I would have been waiting for January, February to get a Medicare Advantage check at that time. This product that we went over is what put food on my table. And starting out in that journey, it was year one. I was an LOA agent. And what we decided to do was put me in Walmart kiosk, if you ever remember doing those.
Yes.
But I started out on a Walmart kiosk and was generating a little bit of business. But what I started to do was be able to cross-sell. As this would have been my 6 month in business, I was able to start pivoting and cross-selling these hospital indemnity plans to bundle with the Medicare Advantage plan. And I'll be honest with you, Rob, there's a couple of Advantage plans I didn't even sell, but I still sold this plan. And I was still able to gate the client later on, even though they're in the best position for themselves at the moment. They did not have one of these. And so that's kind of how this product started about. And then from there, once you learn more and more about a product, how it works, how it pays, it's just a, it's a snowball effect as you go down that hill. So it's a lot of fun.
Yeah, I think it's a great nugget that you point out. And listen, I want you to go back and rewind it if you're listening or watching this today, is that you can attach these to existing Medicare Advantage clients. I see so many agents miss that and they think, oh, they already have a Medicare Advantage plan, can't do anything with them. But as Zeb told you, and I've seen it in my own agency as well, we attach tons of hospital indemnity plans, because you know this, Zeb, there's a lot of agents, and I don't mean this to throw shade at anybody, but there's a lot of agents that get lazy with it. They just take the low-hanging fruit, and they really don't do the necessary research, if you will, or deep dive to make sure that the client is fully protected. So I'm definitely glad you bring that up. So let's talk about a hospital indemnity plan, right? This podcast is focused on brand new agents, first year agents. They're excited, they get licensed, they take their AHIP, and all of a sudden they're like, what to do next, right? What is this hospital indemnity plan? talk about the need for when we sit down with a Medicare Advantage plan, the need for this hospital indemnity plan to come in and fill in those gaps. There's several main copays that we need to look at. Is that correct?
There really is, Rob. And also designing the conversation to
Mm-hmm.
not be a sales conversation, but
Sure.
educational experience for the client has been
Yes.
probably one of the most influential things on whether I get a sell or not,
Sure.
because at the end of the day, I honestly, and you probably feel the same way, I don't feel like we're
Mm-hmm.
selling this product to our clients.
Sure.
They really, there's a real belief in this product because there are a
Sure.
lot of gaps in these Medicare Advantage plans that need to be compounded, covered, so that
Mm.
in the instance that a client has to use their medical insurance, they're
Yes.
also have a coverage filler gap plan to come in there and help them with that. So while saying that, one of the biggest things for me, if I knew this when I was a new agent, is learn Medicare supplement just as much as you want to learn Medicare Advantage. And
Yes.
that's the big swinger right there, is because when we're learning the Medicare supplement plan and then being able to educate our clients, whenever I sit down with someone who might be turning 65 or even someone who doesn't understand the coverage that they have right now, I always take them back to, well, there's two options for you whenever you get Medicare. You're going to go on this or you're going to go on this, whether that be Medicare Advantage or Medicare
Mhm.
supplement, and them understanding the cost of that and the cost of standalone Part B drug plans. As Rob, majority of Medicare Advantage plans are not going to have a prescription, a premium for the prescription drug plan on the Medicare Advantage. But as a
Sure.
client learns that and learns the savings if they do decide to go with Medicare Advantage, you're able to easily transition that conversation over to the hospital indemnity plan. And the client's not, they're just going to look at it and say, that 27 to $35, that's what I could have been paid for a drug plan. And I'm going to say, you're exactly right. And so that makes that conversation a lot easier to have. So if I was a new agent, I would really want to learn my Medicare supplement plans just as much as I would want to learn Medicare Advantage or a hospital indemnity plan at that point. So
Yeah, I think that's another good nugget. So once again, I don't want to just blow past this point. You're telling people or encouraging agents when you learn the original Medicare side of things with the supplement, drug plan, ancillary plans, you're using that whatever that drug plan money would be, because there would be a premium associated with it. You're showing them how, if you're going with option two, you can redirect what you were going to pay for this drug plan and put it into better protection. Is that correct?
that's exactly right. I talk about it
Yeah.
as a reinvestment. They're just investing their money
Mhm.
at that point because with a drug plan, as you know, if they were to do the supplement, they have to do it because if they don't take the Part D plan, what's going to happen? They're going to be penalized by the federal government for not having drug coverage at the age of 65.
Right.
And so for them, when they're getting that drug plan for free, I just have that easy conversation of, do you want to reinvest that money? Because it was going to
Mm.
go out the door maybe either way. What about this? What about us doing this? And so, well, I guess we can pivot that conversation to the hospital indemnity plan, talking about like the copays, the coverage, and different things like that.
Sure.
Though, I mean, I know how you set yours up might be a little bit different than ours,
Yeah.
but if I was a new agent, I always want to cover the big three, and that's how I
Okay.
talk to a client as the same. Well, we
Okay.
have the emergency room, the ambulance, and your nights in the hospital. Okay. And I
Okay.
say, Mr. and Mrs. Smith, most of your medical copays on a Medicare Advantage plan, you're going to be able to handle. Can you handle a primary care doctor visit of
Sure.
$0 to $5? And they most of the time look at me and I ask the question and you got to be quiet and just listen.
Mhm.
They're going to say yes. Can you handle a specialist copay maybe every 6 months that you see a specialist for $30? Yeah, labs, imaging, all these, maybe an x-ray for 15 bucks. Most of your clients, just like you, can handle the smaller copays. And these copays obviously are going to be very drastic
Sure.
between what state we're in. I'm more speaking to Missouri and Rob's
Sure.
in Mississippi. So they're going to fluctuate and change.
Yeah.
But whenever you get down to the nitty gritty, I say the big three is what you're going to experience a pain point whenever you come into
Okay.
Medicare. And I took an ambulance to the emergency room and I spent 3 to 4 nights in the hospital, right? And that could be anywhere from 18 to $2,100 in copays for your clients. And so that's where we use the hospital indemnity plan to come in there and fill in those gaps with those big three. as far as that goes.
Yeah. And are you using, when you're explaining that to the clients, whether in person or over the phone, do you use a platform that kind of shows you the summary of benefits, and then you just kind of are able to know those numbers? Talk a little bit about that for a brand new agent who's trying to figure out how to quote this and or review the summary of benefits with clients on the Medicare Advantage plan. What platform are you using?
I love that. I love that. That's a great question. So you
Mhm.
got a couple platforms that you can use. Whenever I first started as a brand new agent, and if I was speaking
Okay.
to anybody anywhere, I'm going to use Medicare.gov. It
Okay.
is the number one website that you can use no matter what to get accurate copays for someone's plan and know that
Okay.
that's a factual thing. For
Okay.
us, we pivoted more to using like a Medicare Center,
Okay.
an integrity based website that
Okay.
we're with being partnered with who we're partnering with over at Lasting Mark. We have access to that integrity based website where we can
Sure.
pull copays up on a screen. We can also screen share that to the client. There's different little things, nuggets there that you can do, but you have a couple of different platforms as a new agent that you can use to be able to illustrate where you're trying to go with that for sure.
Yeah, and I love that. I started, I grew up on Medicare.gov as well, and then I pivoted to more Sunfire, right, and kind of use that more. I know some people use Medicare app, but I started using Sunfire. And for those watching today, really these platforms have everything spelled out for you. You can literally just go from A to Z and talk about the summary of benefits, and along the way, you're priming the pump, if you will. You're letting them know about these copays that Zeb was talking about. And we do it very similar. I usually tackle five. I'm usually going to do the ER, the ambulance, the outpatient, the inpatient, and the skilled nursing. So as I go down through my presentation, and the summary of benefits, I'm focusing on those. Like, hey, this is a big copay, but here's the good news. I'm going to show you how we can protect you against that at the end. So I'm kind of going through that. So no wrong or right way as you're listening to this today. Everyone's methodology is different. The bottom line is you're doing your client a disservice if you don't bring it up, right? You want to protect them. If you truly feel your calling is to educate and be an advisor, as Zeb was talking about, and serve them at the highest level, then you need to bring this up every time you sit down with the Medicare Advantage client. So let's talk about the inpatient copay real quickly. How do you structure that? Because like in my area, the average inpatient copays for like 7 to 9 days, and it's between about $350 to $400. I know it's going to probably be different where you're at, but talk about how you structure the inpatient copay.
Yeah, yeah, and I mean, I don't even have to give you, what ours, is. If
Uh-huh.
you were a client I was sitting down with, we're going to take the facts. And so if yours
Yeah.
is maybe a little bit higher in the 300 to $350 range, days 1 through 7, right? And that's your
Right.
copay for each night in the hospital, then that's what we're going to try to tackle. And so there's a couple of great hospital indemnity companies. The primary one that we use would be in Heartland National. So
Okay.
the way their benefit sets is in $50 increments, and so we can tackle that from 50 to $600 is the cap there, but in every $50 increment from there. So you're talking about $350 days 1 through 7. We would love to set that at 350 to cover that copay, and then tackle the days 1 through 7 as you're able to choose days like 1 through 28 to 35. But we're going to stick within whatever the means of our client is, because we know if a client stays over night 7, that the insurance is coming in there picking the rest of it
Sure.
up. So no need to give more than what's needed. And what Heartland does super, super well, which we can get into with the inpatient days, is it has a
Sure.
restoration of benefits. And so they don't need 30 days, because 60 days from that event, they're going to have a restoration of benefits, which we could talk a little bit more about later. But it's just a great, phenomenal plan where you're able to fill that gap in, like, most of the time exactly to your client's needs. And when you're using the heart and when you're quoting that to them and you're talking them through that and walking them through that process, they can really see how you're putting those copays on there. And you can go reference back to either Medicare.gov or wherever you might be using that to talk about their medical copays. And they're going to see how you're going in and not trying to cover thousands of dollars, but just exactly what they need so that they're paying for exactly what they need and not a lot more. So, and the clients love that.
Yeah, and so we don't forget to tackle that. Talk about or define what restoration of benefits is. Just because, like I said, these are first year agents. They're learning this thing. What does that mean, and how is that a value add on to the clients that you're meeting with?
Right, right. So with an exact policy like Heartland National, with their
Mhm.
policy, what you're going to see is if your client goes in and stays, let's say 3 nights in the hospital and you have it set for 7, right?
Mhm.
Well, within 60 days, if they're to go back into the hospital, they're still going to have their 4 payable nights available to them. But 60 days from the demission of their first event, 60 days from then,
Mhm.
they're going to have a restoration of benefits back to the full 7 nights. Whether they use
Yes.
the 3 or whether they used all 7, they're going to be able to get all of those nights back. And so, what your client gets to know about and what they get to see is they have a policy that can pay them multiple times in a given year with a tax free check in the mail as well. So, it's a great, great way, and then also, if the client really is having a bad year, whatever your max out of pocket on your Medicare Advantage plan might be, your client could end up making money, but that just depends. But that restoration of benefits is there that 60
Yeah.
days after that hospital stay, they're gonna get their nights back. And I almost sound like I'm a Heartland National, like this is not sponsored. I'm not getting paid for this. So,
Yeah.
but it's a great, great policy.
Well, no, I echo what you're saying, or second what you're saying is that Heartland is one of the best to do it in the industry. I love their team. Their customer service is phenomenal. They pay claims really fast. You have confidence that when you promote that to your client, that the Heartland team is going to stand, behind it. So yeah, I totally get that as well. Real quickly, talking about the inpatient stay, right? We've tackled that. Now the ER copay stay, like in my area, the ER copay is about 1 to 115 on some of the Medicare Advantage plans. What does Heartland pay for that?
Yeah, yeah. So Heartland's is going to, on that question would be 150, right? Would be that
Okay.
reimbursement from the Heartland plan. So your client's going to see, a 40 to $35 difference there, for a hypothetical. And you're going to see with the ER copay, with as long with the inpatient being able to use it multiple times in a given year, that ER copay is payable out 4 times a year, right?
Mm,
And that is gonna
yes.
reset every calendar year for your client. So, as long as it's outside of 48 hours with Heartland, you can go back to that ER and you're gonna get that paid out again 4 times in a given year, and that restores every single calendar year. And then
Yeah.
we can move the ambulance if you want to,
Yes.
right?
Go ahead. Yeah.
I don't know what yours is. Here we have around $350 on the ambulance
Yeah.
copay, but
Same.
that Heartland plan on the ambulance side is going to be a $200 reimbursement, and that's going to be payable out 3 times a year. So that's what your client can see. Is your client can see that if they had a copay for their ambulance of $300, most of it will be eaten up with a $200 reimbursement there. If your client had a $100 to $115 ER visit, they're going to see full coverage of that copay there, making a little bit of money, just a little bit. And then if you're, with your days in the hospital, your client, if they
Mhm.
stay 3 nights in the hospital, have a $300 copay, they no longer have to pay that $900. It's now going to be taken care of completely by Heartland, and they don't have to worry about it. And what that all in our state entails, and it fluctuates, but your client's paying around $30 to $35 a month for this product. I mean,
Sure.
you can't beat it. And Rob, do you want me to mention that last and final thing that when I always call the 4 good things I like about Heartland? That's what I always tell my clients. I was like, I've gone
Sure.
over the restoration benefits, the multiple uses for ER and ambulance, but the number one of the best things about it is the premium lock feature. And so
Yes.
whenever the client decides to take that policy out, whatever the premium is on the screen, you can say Mr. and Mrs. Smith without a shadow of a doubt, whether you get older, whether you make claims on this policy will never increase on you. And you can see in their eyes, they start to light up and they're like, there's not a lot of insurance that ever does that. And the most thing I know about insurance is it goes up every single year, whether it be our cars,
Mhm.
Medicare, whatever it may be. That's all they know. And so when you're able to provide a premium lock feature to your clients where they know that they're going to get paid out money if something's to happen to them in that category or any of the categories that you choose. Your clients love, love, love it. And I know Rob's experienced this. I've experienced this. They're
Mhm.
going to, once they've used it for the first time, they're literally
Yeah.
coming back to you and saying, I didn't know about it, but that was the right decision. We made the right decision. And so that's where they see you as someone who's more of an advisor than just an insurance agent. And as I was like just learning the business and getting into it, whenever you start to pivot from just the Medicare guy into the advisor guy, that is
Yeah.
really where you can change your life, change your income and that's where you want to be is you want to be an advisor, but you need to be experienced enough to do it. And being able to protect your clients like this is one possible way to show them you're an advisor for sure.
Yeah, I love that you bring up the point because I think a lot of people in our industry miss that. They just kind of stay in that agent mode, just selling, selling, selling. And once again, I mean, I know we're in sales, right? But if you can learn how to educate and advise, to me, it brings more credibility. Makes you look more professional in their eyes. And like you said, I've never had a client like be mad at me and go, "Man, I just got reimbursed $1,000 using this Heartland policy." Right? They're
Right,
usually
right.
calling you up or texting you, going, "Zeb or Rob, thank you so much for telling me about this plan." I had a lady recently that had about a $4,000 bill. By the time Heartland was done paying all their stuff, it was like 60% less, right? And she was
Yes.
blown away that Heartland would pay all that. And I don't want to overlook this point, but real quickly, let's talk about this. Heartland's reimbursing them, right? They're getting the money. So can you talk about that real quickly, Zeb?
Yeah, no problem at all. I mean, that's honestly a really big thing. And I think as a new agent, you really don't
Sure.
understand how
Yeah.
important that is. But what you got
Yeah.
to understand, like Aflac and different things that our clients have been used to in the past, and I'm not just calling out
Yeah.
Aflac but different reimbursement type policies or indemnity products in the insurance industry, they actually pay out to the hospitals. But what happens a lot of the times is those indemnities are covering the full cost or copay of the client, but the rest of that money is where's it going? And it's so
Mhm.
hard for your client to get that money from the hospital. They're just going to absorb it. And so what
Right.
Heartland does so well is sending that check in the mail to the client's address, to their house, for the client to deposit that check and it being tax free income as well
Mhm.
and then go and say, take that money and then pay. And this is a joke I've always said, Rob, as like, Mr. and Mrs. Smith, you can take that money and you can pay off your hospital bills with it, or you can take it and you can go to Vegas and double it. But it's completely up to you what you do with the money.
Right.
Once
Yeah.
Harlan gives it to you, they don't care. Now, we want you
Yeah.
to pay your hospital bills, but that's
Right.
just an example of the freedom that the client has with that to be able to do that. So as a newer agent, it's very
Mhm.
important that these clients are getting that check and the hospital is just not absorbing maybe if there's leftover money or funds or whatever that might look like in that example, Rob. So yeah, like you said, that's actually a really important feature for sure on that plan.
Yeah, and I love that you bring that up too, because a lot of times, these ads on social media, on TV, online, the phone calls, they're all just geared towards 0, 0, 0, dental, vision, and they don't tell them about these gaps, right? I can't tell
Right.
you how many times I get on the phone with existing Medicare Advantage clients, and no one has ever told them about the gap plan. Right. That's what I call it. I keep it real simple. I don't speak a lot of insurance needs. I keep the cookies on the bottom shelf, if you will. And so that's a great point that you bring up. And real quickly, and then I want to move on to a couple other things. Whether you live in Missouri, Mississippi, or wherever, Heartland may or may not be available where you're at, but there's other carriers that you can utilize as well. I'll show you how you can get in contact with Zeb at the end, and he'd be more than happy to coach you through that and help you get some contracts if you need that. But in my area, I also talk about the outpatient and I talk about the skilled nursing. I won't take a lot of time there, but wherever you're at, whether it's 3, 5, 4, the bottom line is you want to bring it up. And even with 4 in my area, without the skilled nursing, Zeb, it's $60 to $65. But I'm priming that pump from the very beginning, right? I'm stopping as I'm going through the presentation. The skilled nursing I'm talking about. And I always tell people I'd rather start at the top because it's a lot easier to come down than start at the bottom and go up. But even if I do all five, it's normally about $65 to $75 in my area, right? If I just do four, it's normally about 60 to 65. If I just do the big three in my area, it's a little bit more. It's about $50 to $55. But regardless, most people never really bark at it, or they just go, yes, I need that coverage if you do what Zeb is telling you to do and you're taking time to educate and advise. Now, one feature we haven't talked about is the guaranteed issue period. So define that, explain that, especially if you're meeting with a lot of turning 65 clients.
Right. When you're meeting with a lot of turning 65 clients, Heartland specifically does a great job with their guaranteed issue period, which is no pre-existing conditions, no health questions asked. I always
Mm-hmm.
tell a client, Mr. and Mrs. Smith, that just means that this policy is guaranteed to issue. Like it's going to issue out, it's going to go effective. And that's what guaranteed issue means. For us, insurance needs guys, we get it, but your client's
Yeah.
not all the time going to get it. So always, reverse yourself and say the same thing a different way, and it works every time. And your client's going to be happy that you did so. But then moving on from that, they do a great job from 65 and a half to, what is it, 66 and a half, or no, 64 and a half, apologize,
Yeah.
65 and a half.
Yeah.
That's what it is, 64 and a half to 65 and a half. They
Right.
are going to have a whole year time frame to choose that Heartland plan, and it's going to, no health questions asked, no pre-existing conditions. And then there's a couple things in there, like, if there is a pre-existing condition, maybe waiting again 6 months, 6 to 8 months before we use the product for reimbursement on a pre-existing condition. But after that, it's a clean slate for the client, and you can promise your client it's going to work very, very well. And then I just want to give, I know I tell our agents this, especially the new ones. So just a little, I'm going to pivot just a
Sure.
little bit here as we're
Sure.
closing this conversation down. But story facts tell and stories sell. And if you don't have your own
Yes.
stories, someone like Rob, even back in the day when we first met, when I was younger, use my stories instead, right? Brian Askins told me that. Rob's told me that. Lots of great people have told me that. So I'll give you a little story here. We had a client come in, it was probably 6 months ago, turning 65, did everything we're talking about today. In the meeting, told me, I don't really think I need this. He was perfectly healthy. He wasn't even on any medications. I don't really
Right.
think I need this, but I'm going to trust you and we're going to try it out just because of the guaranteed issue period of 64 and a half to 65 and a half. He wanted to make sure he got it. And you can always use that to say, hey, this is a great time to look at this policy and grab it now because later on there might be health questions. So always you might want to use that one later on down the road. But he ended up taking the policy out, and a month and a half after he took the policy out, he had a heart attack, spent 4 nights in the hospital, and he had Heartland come in and only a month later pay for the majority of his hospital stay. Like you've
Wow.
seen what we're talking about in these copays here for the inpatient and the different things there. He took an ambulance, he went through the ER, all the things. And he called me back and, just, man, thank you, thank you, thank you, thank you. Well, long story short, we just got done finalizing his brother-in-law, who just turned 65, off a referral basis. And we looked at the Heartland plan, and he said, my brother-in-law, the first guy, he said, I would be an idiot not to take that policy right there. He told me he didn't think he needed it, and he immediately used it, and it worked great, paid him out, everything worked. So as you guys are becoming advisors in this, when you get the influx of maybe a referral here, referral there, but they're seeing how the product worked for them, your clients will sell the product before you ever have to do it. And I've sold Medicare Advantage plans off of sisters or brother-in-laws or aunts or uncles saying, well, this other plan works so good. You need to go get this plan from him. They come in to get the Heartland plan, but they're not even my
Mm-hmm.
client. So I end up getting the advantage later on down the road too. So I'm telling you guys, when you do a full circle basis, you open yourself up for so many more options than, like, kind of like Rob said, than just being just the Medicare or just the agent guy. You want to be that advisor guy. So anyways, didn't mean to get too far off subject there, but I love that story.
Yeah.
It's so funny when you get to see that work for full circle, Rob.
No, I definitely think it's a great point because, like I said in the very beginning, there's a lot of agents that don't bring it up. And so if you bring it up, like I had a guy that found me from my webinar, or excuse me, he was referred by a pastor out of Florida. He wanted me to switch his Medicare Advantage plan because his plan was ending in that area. And I said, well, please tell me your current advisor, whoever you were working with, told you about this gap plan. And he was like, what gap plan? Well, I go through it and it wind up being about a $65 to $70 a month gap plan add-on. And he was like, man, I can't believe this other agent didn't tell me about this. And so you're exactly right. And he said, I'm going to go back and tell everybody in my church about this, right? I want them to know because they're all on the same plan that I am. On the other side of things, for you new agents, you want to bring it up in every appointment and don't judge, don't prejudge, don't think they can't afford it. Because if you give it to client A, right, and then you don't give it into client B, and I've had this happen before where client A actually knew client B, or they had a circle together. They're like, well, why did Rob tell my friend over here, but didn't tell me about this plan, right? So you really want to get in the habit early on of bringing this up. A couple of things as we close shop today. Our time has went by really, really quick. Talk about the stickability factor of adding multiple policies in a home. Talk about how that has affected your agency.
I mean, it always matters. No matter what you're doing, it always matters. The more policies that you have in a household, the stickier your business is every single time. As I've done this for, I think it'd be 7 years now that I've been doing Medicare, from the beginning to maybe offering it to 25% of people or 50% of the people I met with. And a lot of that, Rob, I hate to admit it, but a lot of that had to do with, judging the book by the cover, right? As you talked about, you never want to do that. And I've had stories like that. You told them about that, but not me. Why? Like, when I'm not healthy enough? Oh no, you're healthy enough. Well, I want that.
Yeah.
You hear it. So yes, it does happen. Stickability is a huge thing. Excuse me. But the more policies that you have in the household, you're going to create stickier business. But I've always heard that adage, and it is very, very true. But I also believe that the more policies that you have in the household, the more referrals that you generate for yourself.
That's good.
Because if someone asks a client about, what about dental? What about this product? My hospital bill? What about my prescription coverage? If you're just handling one thing, you're going to be known as the guy that just does one thing. But if you're handling an array of products where you're able to help people in a multitude of ways, you're going to generate, a full circle business that just for some reason, somewhere over here, someone else might come in and you're going to be able to help that person solve their problem and maybe help them in another aspect as well. So it's a great way to do all those things above.
Yeah, such a great point. The more policies you have in a home, the more referrals you get because people know that you do more than just Medicare Advantage plan. I don't want you to miss that today if you're watching this. That's a great point. All right, we got to close shop. How do people, they say, I like this Zeb guy, man. He's been bringing fire for the last 32, 33 minutes. I want to connect with him, maybe get some coaching, possibly even join his team. What's the best way to connect with you online, by phone? Is there a website? Give us that information. We'll put it down in the video description below.
Yeah. So our website is zzinsurance.com. So that's how you can reach out and get to us. And then if you ever want to contact me, my email is the best way to do so. And that's ZEBZINN secure, SECURE @gmail.com. And that is the best way to get a hold of us. You guys are more than welcome to reach out. Love to help people. Doesn't matter if they're clients, doesn't matter if they're agents. I just love to help people. So we would love to help you in any way possible.
Well, Zeb, you brought a lot of value today to our audience. Appreciate you doing that. And listen, you go ahead and start today, right? I tell people all the time, your confidence will catch up. It's just your job to go ahead and put this thing into motion. Get with somebody that can help you learn this hospital indemnity plan, get coached up and just get out there and start presenting it. Because I promise you, your clients will love you for it. And by the way, if you've gotten value out of today's podcast, take a moment to like, comment, subscribe. This helps me get this information out to more agents like yourself. And I want you to go check out this interview I did with an ex-football coach. He was making about $27,000, $28,000 a year. And he's on track this year to end with $12 million in his Medicare agency. And you can check out that podcast interview right here.